We have 8 billion people in the world. Majority of them do not have access to healthcare, and we're never going to build enough hospitals and clinics to take care of all of them. That's why community is important, because health is going to happen at the community level. And the only way we're going to get access at the community level, again, never going to have enough of a health workforce to be able to reach out to all of them, is through technology solutions. Hence, digital and community have to go together.
How do we better do that work all together as an ecosystem so that there is more investments going to the ones who are inventing good solutions, local solutions, affordable solutions for the people we absolutely need to help, who are this community effort.
And to get a positive result from a healthcare program, it's not just one entity. It's private entities, it's governmental entities, and different departments within the government. Different kinds of technology. Digital health is a very broad kind of terminology. It has lots of things in it. And so to get all the stakeholders aligned and in many ways inspired and motivated by a vision of improving people's lives around the world, I think just getting that message across and aligning everybody is probably as big a barrier as anything.
Before you'd have a community health worker, you'd have to actually go there, do the initial training, go and do a refresher course, and it might be the wrong course at the wrong time for the health worker, because actually they have a lot of other issues they need to deal with within their own community. Now it's the right training at the right time for the health worker, because actually through digital health you can identify what are the areas that the community health worker is struggling with. What are the areas through a good monitoring system where we need to improve the training and maybe focus a little more?
I think the challenge there and the task that we have to face is how do you then take that visibility, take that technology and focus it. Focus it on something that changes an outcome. And I think the general thinking is more towards building tools, which is important, but how do you apply the tools is very important.
What is important is also not only for the community to be able to use that data, but for the facilities in terms of their planning. Because based on the data that is going to be collected from the household level in that particular community linked to a particular facility, they can be able to visualize what kind of healthcare problems they are dealing with. And in terms of their planning, then they can be able to sit down and prioritize the interventions that they are going to take going forward.
At each of those levels, you really have an opportunity to think about how you're designing, making sure that that you're looking at the system comprehensively, and making sure that you're not excluding key components of either the population or the health workforce when thinking about digital system design.